Hi, Dr. Eric Lund here, specializing in short-term care for your back pain and neck pain, and welcome to your weekly pain relief video. This week, the topic I'd like to discuss for you is associated symptoms with lower back pain. Lower back pain is very common, and we can probably all relate to someone who's in lower back pain. They're leaning forward with their hands on their knees, trying to avoid movement because of the severe pain. However, there can be associated symptoms with lower back pain such as leg pain. This could be like numbness, like tingling, leg pain or a sharp shooting pain into the leg. And typically when these associated symptoms occur, people can be more concerned and worried. And that's the topic that I would like to address for you in this video. So the first thing that we need to do for you is to look at some of the anatomy to better understand why the leg symptoms would occur. And when we look at the anatomy, the front of each vertebra has what's called a vertebral body. And then between each vertebra is a structure called the disc. The disc is that shock absorbing structure. And then on the back of the vertebra we have something that's called the spinous process. Now that's something that you can either see or you can feel on the neck or in the back. And what connects the vertebral body to the spinous process is something that's called the pedicle. And if for whatever reason genetically you have smaller or shorter pedicles, that is going to create a situation where there is less room or a less of an opening or a smaller opening for the nerves of the lower back to exit, increasing the chances of them becoming irritated or compressed and causing those leg symptoms. Then if we add an older person or as we age, there can be degenerative changes or arthritis. And so if you take someone with shorter pedicles and now you add in some degenerative changes, it can create a situation that is called, or a condition that's called stenosis. And stenosis just means that there's a smaller opening for the nerves or the structures associated with the spinal cord. And again, this could cause leg numbness, leg tingling, or leg pain. Generally, if someone has stenosis or stenosis is causing their leg symptoms, they typically will experience their leg symptoms when they're standing or when they've been on their feet for a while or walking, and then generally what will feel good is to stop and to lean forward, or what will feel good too is to sit and to lean forward. That generally will relieve the leg symptoms when stenosis is the cause. Now if it's a younger individual or a younger adult, one of the structures that we have to consider would be the disc. Now the disc could be herniated, or the disc could be bulging or simply inflamed. If the herniated disc is causing the leg symptoms, generally those individuals can specifically trace the route of discomfort in their leg. So they can say it's going down the left side, and then when it gets to the calf it crosses over. So it's a very specific pattern that they can describe. And also with a herniated disc, generally sitting will make it worse, leaning forward will make it worse. However, if they describe their leg numbness or tingling or leg pain as kind of generally throughout the entire leg, and they can't pinpoint a specific or trace a specific pattern of the leg symptoms, then that leads us to believe that it is likely more of an inflamed disc or a bulging disc, or coming from the joints of the lower back. And again, with this cause also, sitting is going to make it worse. Leaning forward is going to make it worse. The good news is that Chiropractic offers a non-invasive, non-surgical treatment that is effective for all of those causes of leg pain, leg numbness, or leg tingling, whether it's stenosis, whether it's degenerative changes, a herniated disc, or simply a bulging or inflamed disc. So if you're looking for further information on this, I'd encourage you to go to my blog, www.drericlundblog.com, and there you can download a free guide to back and neck pain relief. So again, thank you for watching, and we'll see you next time.